Hello, good day. My name is Joy B. Salvedia, a first-year BS nursing student. And today I am going to discuss about a female reproductive disease, which is the chlamydia. So, what is chlamydia? Chlamydia is a common sexually transmitted disease. Not only it infects women, but it also infects men as well. Women can get chlamydia in the cervix, rectum, or throat. If a woman can get chlamydia, it can cause serious permanent damage to a woman's reproductive system. If chlamydia is not treated, this can make it difficult or impossible for a woman to get pregnant since chlamydial infection can spread to the uterus or fallopian tubes and can cause pelvic inflammatory disease, or which we call PID. PID can damage the fallopian tubes and uterus and can cause chronic pain, infertility, and potential fatal ectopic pregnancy. Here is a picture of a chlamydial infection, specifically in the mouth. Possible signs that you may have an oral chlamydia include a sore throat that doesn't go away, along with a low-grade fever, swollen lymph nodes, oral sores, or white spots in the back of the throat. As you can see here, there are white spots all over the mouth and the lymph nodes are swollen as well. In some cases, one might confuse these symptoms with strep throat or some other kind of throat infection, but in reality, it is already a chlamydial infection. Moving on, let us discuss about the pathogen or causative agent of the chlamydia. The pathogen or causative agent of chlamydia is the Chlamydia trachomatis. It is a bacterium that causes chlamydia, which can manifest in various ways, including trachoma, lymphogranuloma venereum, pneumococcal urethritis, cervicitis, salpingitis, and pelvic inflammatory disease. Chlamydia trachomatis is a gram-negative bacterium that can replicate only within a host cell. So we all know what gram-negative bacteria is. It is the characteristic of bacteria that have a cell wall composed of thin layer of a particular substance, what we call peptidoglycan. Like other chlamydia species, the Chlamydia trachomatis life cycle consists of two morphologically distinct life stages, which are the elementary bodies and the reticulate bodies. So, if you're wondering what elementary bodies and reticulate bodies are, elementary bodies are spore-like and infectious, whereas reticulate bodies are the replicative stage and are seen only within the host cell. So in the left shows the picture of a life cycle of the chlamydia. Now, let us discuss about the reservoir and the mode of transmission of the chlamydial infection. Humans are the only natural host for the Chlamydia trachomatis, and it multiplies only inside of the human cells. To do so, they first have to bind to the host cell from the outside and then enter the cell in a second step. Understanding these two mechanisms is one of the key research areas at the Institute of Functional Genome Research of Microorganisms. Chlamydia is a bacterial infection. The bacteria are usually spread through sex or contact with infected genital fluids, or what we call semen or vaginal fluid. You can get chlamydia through unprotected vaginal, anal, or oral sex, sharing sex toys that are not washed or covered with a new condom each time they are used, your genitals coming into contact with your partner's genitals, and infected semen or vaginal fluid getting into your eye. Pregnant women who are also infected with chlamydia have an increased risk of their waters breaking prematurely, causing the baby to be born early. If a woman has chlamydia when giving birth, the baby might become infected during the delivery. So, There is no need to worry about getting infected with the chlamydia since it cannot be passed on through casual contact such as kissing and hugging or from sharing bath, towels, swimming pools, toilet seats, or cat litter. Moving on, let us discuss about the laboratory diagnosis of the chlamydial infection. Screening and diagnosis of chlamydia is relatively simple. The tests include the urine test. A sample of urine is analyzed in the laboratory for presence of the chlamydia infection. And a swab. For women, the doctor takes a swab of the discharge from the cervix for culture or antigen testing for chlamydia. This can be done during a routine pap test. Some women prefer to swab their vaginas themselves, which has been shown to be as diagnostic as doctor-obtained swabs. If you have been treated for an initial chlamydial infection, it is recommended that you should be retested in about 3 months. And lastly, we are going to discuss about the patient care of having a chlamydial infection. Once diagnosed, chlamydia is easily treated and cured with antibiotics. A week of doxycycline twice a day or 1 dose of azithromycin is a typical regimen. Teach patients to abstain from all sexual activity until they complete treatment, and their sexual partners must be treated as well. The patient should get a follow-up testing in 3 to 4 months to ensure she hasn't become reinfected. Reinfection following successful treatment of chlamydia is very common, so make sure your patient knows that her partner must be treated and that successful treatment doesn't make her immune to future infections. So, that is all about my report about a female reproductive disease, which is the chlamydia. Thank you for listening, and I hope you learned something about my report. Good day and God bless.